It's WCCS 101.1 FM, AM 1160, and WCCSradio.com. Glad that you're with us on this Tuesday morning. It is May the 2nd, and we mentioned this yesterday that we begin a series of observances in this month. It is Mental Health Awareness Month. It is also Stroke Awareness Month, and we'll be visiting you on a number of various topics involving stroke awareness. With that in mind, we welcome into the studio today Dr. Gregory Lynch and Victoria Puckett, vascular surgery. Morning to both of you.
Good morning.
It's good to have you both with us. Our conversation brought to you by Marcus & Mack, voted best personal injury law firm in the Best of Indiana County contest. Marcus & Mack, a law firm representing injured people. So, circulation, who needs it? Dr. Lynch, a lot of people need it. Everybody needs to have good circulation, and that has a direct connection to stroke, doesn't it?
Correct.
Yeah.
I was going to say, although our conversation may not show that we have circulation, we do have circulation to our brain, and it is important that we all work on that to maintain good circulation. We would like a stroke-free Indiana County. That's our goal, and towards that end, we come and talk to you and discuss what we can do as a medical team as well as what people can do as individuals.
Yeah. Victoria, there are a lot of things that people can do, but IRMC is a really vital part of the whole circulatory equation, isn't it?
Yeah, definitely. We see patients every day for vascular surgery, but specifically to stroke, we offer carotid ultrasound, and we also offer two procedures that Dr. Lynch, I'm sure, would like to speak about. We offer the carotid TCAR.
Tell me about that. What is that?
The TCAR is a stent that's placed via the carotid artery, and it actually uses a reversal flow to help prevent stroke intraoperatively. So we're reducing your risk of a stroke while we place the stent for specific candidates that are high risk for surgery or have had previous neck surgery, previous radiation to the neck. So a carotid endarterectomy, which is an open surgery, is not the best option for them.
Mm-hmm. Dr. Lynch, when we talk about circulation and specifically related to strokes, we're really talking about that pathway from the heart to the brain, aren't we?
Correct, yes. And we mentioned the TCAR procedure. It used to be that we would place stents, if needed, from the groin area all the way up to the neck. That passed the major vessel, the aortic arch. And it was quickly identified that manipulating in that area to get to the carotid vessel caused stroke itself. Mm-hmm. So as a result, this little incision at the base of the neck avoids that manipulation of the blood vessels in that area, and the reversal flow together cause a decreased risk of overall stroke during this procedure.
You know, we see the diagrams, and the diagrams are obviously expanded so we can really get a look at them. This is really microscopic work that we're doing, isn't it?
Yeah. Well, the elements that we're trying to avoid from embolizing towards the brain are microscopic, and again, the work is all towards eliminating any flow of bad material to the brain.
Yeah. So, Victoria, when we were talking about stroke and circulation and vascular services offered at IRMC, Dr. Lynch mentioned, there are ways to prevent or at least to stave off the effects of stroke, and those are the first things that we need to pay attention to, aren't they?
Yes, absolutely. Our number one thing in the office is always tobacco-free. So we encourage patients, support them, offer them ways to help quit smoking. Obviously, we know that it is a strong addiction, so it's a slow process, but we hope that we're there for them each step of the way as they come off of the tobacco. That's usually our number one issue that we have with all vascular disease, actually. And then second thing we try and do is prevent a healthy lifestyle. We encourage lots of walking. And I usually tell patients, walk till you drop. It's great for you. And then a healthy lifestyle as far as eating, so a better diet, and we go over all those things.
So, and walk till you drop. That's within limits. But we don't want you to step in too soon in that formula. But those types of lifestyle things, they really translate to other areas within the body. When you're talking about the diet and the exercise, those are things that we hear all the time in relation to our overall body health. So obviously makes sense for circulation too.
Yeah, I mean, in regards to the carotid, the vascular issues also are everywhere else. Cardiovascular, your arms, your legs, your belly. So it all plays into a fact of getting all of those vessels more healthy.
When we think, Dr. Lynch, about the carotid artery and stroke, but really about circulation overall, there are signs that we can look for that there might be a problem that we need to get handled and pretty quickly, aren't there?
Yes, yeah. So we term them TIAs, transient ischemic attacks, and the symptoms in that regard are temporary blindness, drooping of the facial area on one side or the other, weakness of arm or leg. There are some rare presentations where people actually have what we call limb shaking TIA, where an arm or a leg will just on one side repeatedly shake. Again, it brings up the need for use of all the consultants. We mentioned carotid as a cause of stroke, but we know that comprises maybe just 30 to 40% of people. The other causes of stroke include central nervous system, brain strokes of themselves, as well as cardiac irregularities that cause stroke.
Are there family or genetic factors that play in here as well?
Yes, we do see that the people with atherosclerosis have many different patterns of disease. But again, a good physical exam by the primary care, along with taking the history of the family, can incorporate, or develop a good game plan to prevent stroke.
Yeah. Yeah, Victoria, when we're thinking as well about cardiovascular services, surgery is obviously something that is a key part of it. But there are medicinal ways to attack our circulatory problems too, are there not?
Yeah, if you're not a candidate for surgery or your carotid disease is not at a point where surgery would be indicated, good medical therapy is our guideline that we follow. So each patient is on an aspirin as well as a statin medication with the addition of occasionally a Plavix or Xarelto.
What are some of the other conditions that vascular services can help us with?
That we provide in the
Yeah.
office. We also do peripheral arterial disease. We also do peripheral venous disease. So we work on the circulation to your legs, also your arms, also to your belly. And then we also provide the main vessel of your belly, the aorta. We also operate on that as well.
Mm-hmm. Dr. Lynch, when we think about the overall body health and we're talking about circulation, and we hear this a lot, and especially we hear it with diabetic patients, problems with the feet and circulation to the feet and those issues. That's obviously something of a concern to you too.
Absolutely. It is, and most diabetics are aware that they are at risk for problems. One, due to circulation, but two, due to loss of normal sensation, which puts them at risk for developing sores. Mm-hmm. Either way, we encourage our diabetic patients to take their shoes and socks off every visit to every physician so that we can have hands-on a good look to look for early signs of problem. Mm-hmm. But again, we find our diabetics do very well with following the medical regimen, good blood sugar control, and walking 30 minutes a day, and frequent inspection of your feet.
That loss of feeling in your feet or the numbness that you might get, obviously that's a sign, but what are the indicators or what does that indicate in terms of your overall vascular health?
Well, it may be independent of your vascular health, or it may be secondary to a problem with the vascular health. Again, it's the importance of inspection and physical exam. Many times the testing we do to try and prove or disprove vascular problems is somewhat shortcutted by diabetic changes. Mm-hmm. The vessels become hard, heavily calcified, and it makes it difficult to differentiate say a spine problem from a vascular problem from a neuropathic problem secondary to just diabetes.
Yeah. Victoria, when we think about vascular services at IRMC as well, there used to be a vein clinic. Do they still do the vein clinic?
I wouldn't call it a vein clinic, but we do see a lot of patients for peripheral venous disease, and we have a lot of connections within the community now as well that offer help with chronic swelling of the legs, wounds that are associated with venous disease. And then we offer a few procedures at the hospital as well to help with some painful superficial venous disease as well. Dr. Lynch does a clear vein procedure in the office, and then we also offer a microflebectomy in the OR as well.
When people come to visit you, is it because they've been referred by a primary care physician or some other physician in the medical chain, or do people often come directly to you with the problem?
I would say it's more heavily that we get patients that are referred, but we do have a fair number of patients that are self-referrals. Some patients that are from out of town also just Google vascular surgery. They find our service and then call to make an appointment. So we accept both self-referral and then a referral from a physician office as well.
I always hesitate to do this, but do you know that number offhand?
Oh, no, I don't.
Hold on.
Dr. Lynch does. He's got it in the wallet. You've got an old-style wallet going there. You got a gum band on that? Oh, this is beautiful.
Hold on.
Now he has to get the glasses out.
Do you want me to
You
read
could just hand it to her. She can do it.
Okay, the number would be 724-349-3170.
Say it again.
724-349-3170.
Beautiful.
And both of us are, we have office hours pretty much every day of the week, Monday through Friday. Mm-hmm. And Dr. Lynch also offers office hours in Punxsutawney as well.
Oh, terrific. Dr. Lynch, Victoria, thank you so much for coming to visit with us today. We appreciate it. Stroke Awareness Month, really, we're talking cardiovascular health as a whole. It's very, very important to remaining healthy and vital within your own community and with your life. Thanks so much for coming in.
Thanks for having us.
We appreciate it. It is the voice of Indiana County, WCCS 101.1 FM and AM 1160, and WCCSradio.com. Fox News is coming next at the top of the hour. We follow that with news from our WCCS newsroom with Josh Widdison.